So let me turn to Mr. Wong. Mr. Wong is 20 years old, a third-year student of Beijing University of Aeronautics and Astronauts, and a volunteer and peer educator at China Youth Network. He has participated and led several projects on promoting young people's sexual reproductive health and rights, such as Dance for Life and projects on HIV and AIDS prevention. The floor is yours, Mr. Wang.
Okay, thank you, Gaoshan. Honorable Ministers, dear friends, my name is Weng Xuanchen. I'm 20 years old, a third-year undergraduate in Beijing University of Aeronautics and Astronautics, and a volunteer of China Youth Network. Despite my young age, I began to participate in public charity activities for cancer patients when I was 6 years old. At the age of 15, I worked together with the peer educators of China Youth Network in organizing activities and campaigns on HIV/AIDS prevention and sexual and reproductive health to the young migrant workers working in the factories in Shenzhen and other southern cities. There are more than 300 million young people in China, which is one of the largest age group of young people in the world. At the beginning of this year, when COVID-19 broke out in China's Hubei province, more than 42,000 medical doctors and nurses from all over the country went to assist Hubei province to fight coronavirus, among whom 12,000 are young people in their 20s. They bravely rushed to the forefront to fight against the pandemic, risking their own lives to save the lives of patients. They are hailed as heroes in harm's way. Chinese young people have made their outstanding contributions to China's control of COVID-19 and gained full recognition and appreciation from the whole society. I'm very proud of the outstanding performance of my young buddies. China Youth Network, and we call it CYN, which was set up in June 2004 with the initiation of China Family Planning Association and support of UNFPA. It's a youth volunteer organization for advocating for the sexual and reproductive health and rights of young people and promoting the implementation of the ICPD program of action. At the beginning of the outbreak of COVID-19, China Youth Network actively mobilized resources of donations. We observed that it was difficult for pregnant and lying women to go to hospital. It was difficult for female medical staff and patients to get sanitary pads during menstruation. Medical doctors and nurses were busy with treating patients, often refraining themselves from going to the toilet in order to save time and save the valued protective suits at that time. These reproductive health needs are easily overlooked. Therefore, CYN volunteers make this as their first priority to mobilize relevant resources. With the great efforts of the CYN volunteers, more than 100,000 medical masks, nearly 100,000 adult diapers, 50,000 nursing pads and penny-type sanitary napkins, as well as other badly needed medical equipment and supplies such as ventilators, portable air sanitizer machines, and disinfectants were successfully mobilized and donated to 87 hospitals and medical teams in Hubei province. Young volunteers from all over the country of CYN had also taken an active part in pandemic prevention in communities, and people saw young volunteers in the communities as prevention gatekeepers, health educators, and psychological counselors. In the past few years, the main achievements of CYN in promoting adolescent reproductive health, which impressed me most, are firstly, motivating volunteers to go into schools, communities, factories, rural villages, and families to carry out reproductive health knowledge popularization activities. Secondly, promoting peer education in universities. University Youth SRH project has been implemented nationwide for 5 years aiming at improving SRHR among university students by providing correct information through life skills training to have a good command of knowledge of self-protect, building good interpersonal relationships, and making responsible decisions. At present, more than 600 universities across China have carried out peer education programs, and more than 1 million students benefited every year. Thirdly, participating in South-South cooperation. Supported by China Family Planning Association, China Youth Network has organized workshops and seminars on HIV/AIDS prevention and adolescent SRHR for young people from the communities in Zimbabwe, Kenya, Cambodia, Mongolia, and other developing countries. The China Youth Network has been playing a very influential role in promoting adolescent sexual and reproductive health, and it is well recognized and supported by the society. I myself, as a volunteer of the CYN, also benefit a great deal from a moral and care development by participating in youth network activities. In the future, we'll make more efforts on innovation in initiating more youth-friendly and age-appropriate approaches for improving adolescent reproductive health in the context of post-COVID-19 and rapidly changing world. We also expect that the international community and government will do more to support youth. Investing in youth means investing in the future. We young people will work together with the whole society in these trying times for better health and well-being of our people and make sure that no one is left behind. Thank you.